Hi everybody, welcome to Dr. Manny's YouTube Learnshops. Today in this session we'll be reviewing what is evidence-based practice. Common term, because we've always done it that way. Should we keep doing it that way? The learning objectives at the end of this session, you as participants should be able to define evidence-based practice, discuss the practice of evidence-based practice in nursing, discuss why evidence-based practice is a trend and an issue, discuss how evidence is incorporated into nursing education and clinical practice, discuss the evolution and challenges of research in contemporary nursing. So, think. What do you understand by the term evidence-based practice? Reflect. Evidence-based practice is the conscientious use of current best evidence in making decisions about patient care from a nursing perspective. It's the collection, evaluation and integration of valid research which is evidenced and combined with clinical expertise and an understanding of patient and family values and their preferences. And this should inform the clinical decision making. Explain, you think. Explain, what do we mean by the evidence-based practice triad? And what does it actually represent? Well, the triad is this. It incorporates, as we said, patient values, best research evidence, and also clinical expertise. That's the triad. What's the rationale then for evidence-based practice in nursing? Well, the rationale is that the purpose or the aim or the objective of evidence-based practice is to use best evidence available when making patient care decisions. Evidence-based practice involves innovation in terms of finding and translating the best evidence into clinical practice. And this can apply to many different skills, protocols that we use in nursing. Why promote evidence-based practice for nursing? Well, we don't want to waste the resources, number one, on ineffective innovations. We want to reduce the amount of disability and suffering of the patients, the people that we're caring for, by giving them the most current and effective care. It also supports the establishment of specific protocols for interventions for the care of our patients. For example, nursing protocols changed by evidence practice could include pressure ulcer prevention, wound care, hand hygiene practices. Think. Are evidence-based practice and research synonymous? Are they the same thing? Well, the differences are research essentially is about developing new knowledge. Research applies a methodology, whether it's quantitative or qualitative, to develop that new knowledge. Evidence-based practice seeks and applies the best clinical evidence, as I said, often from research towards making patient care decisions. Is it a trend issue? Well, today's healthcare environment is really complex. Look at what's happening in 2021, COVID-19 pandemic. Clinical practice and decision making must be based on current relevant evidence. Patients expect to receive the most effective care based on the evidence-based practice provided. Nurses need to be aware of important changes in evidence relevant to their specific domain. And it provides care supported by facts, which also enhances professionalism and accountability for nursing practice. Well, we need to understand that there are levels of evidence. And the evidence is in a hierarchy. You should seek the highest level, which is typically level 1 to 3 of evidence available. But remember that evidence at the top might not exist for your specific clinical question if you're doing research. In that case, you'll have to move down to levels 4 to 7. And in doing so, you need to find the strongest evidence that addresses your clinical question. Now, the top of the pyramid represents the strongest evidence, with filtered evidence and critically appraised topics. And this includes systematic reviews, meta-analyses, and critical appraisals. CAT is basically a short summary of the best available evidence created to answer a specific clinical question. At the base of the pyramid, this is unfiltered evidence, which could include randomized controlled trials, cohort studies, and case reports. And these are individual reports and studies that are also known as primary literature. Level 1 is the systematic review, and it focuses on a clinical topic and answers a specific question. It's thorough. It's a thorough literature search to identify all the relevant studies that use a sound methodology. And these studies are evaluated and the results are summarized according to a pre-selected inclusion criteria. There's no quantitative statistical analysis done here. Statistical analysis is not done. Level 1 also includes a meta-analysis. Now, a meta-analysis carefully examines a number of credible studies on a topic and combines the results using quantitative statistical methods. It's a higher quality systematic review and therefore is at the top of the pyramid. And it uses databases to limit the researcher's search to systematically review and to the meta-analysis. Level 4 are randomized controlled studies. And they're carefully planned projects that study the effects of a therapy, for example, on patients. It includes methodologies that reduce the potential for bias, which is randomization and blinding, and allows for a comparison between intervention groups and control groups. Level 5 is a cohort study, and this takes into consideration a large population and follows the patients who have got a specific condition or receive a particular treatment over a period of time and compares them with another group that hasn't. They haven't been affected by the condition or the treatment is not provided that is being studied. Cohort studies are observational and not as reliable as a randomized controlled study, since the two groups may differ in ways other than the specific variable being studied. Then you've got level 6, which is a case control study. This is observational, and this is where patients who have already got a specific condition, the case group, are compared with people who don't, the control group. These studies are usually less reliable than randomized controlled trials and cohort studies, because showing a statistical relationship doesn't mean that one factor necessarily caused the other, cause and effect. These studies look back into time and maybe on patient records, are typically reviewed. Then you've got case reports, also a level 6. A case report consists of a collection of reports on a specific treatment of individual patients or a report on a single patient. And because they're reports of cases and use no control groups with which to compare outcomes, they have no statistical validity. They're just reports. There are lots of databases that you can employ in order to find evidence-based research. These are just a few. And there are many, many, many more. Now, applying evidence-based practice in nursing typically takes into consideration 5 steps. Formulating the clinical question, searching for the evidence, appraising that evidence, applying that evidence in practice, and then evaluating the evidence. So, think, where do research questions come from? They can come from your clinical practice concerns, therapeutic care related to efficacy, efficiency, effectiveness, and the objective is to advance quality care and address public health issues. And this can be related to lots of different situations that are a concern at this present point in time. So, what are some of the elements of the question? And there are lots of tools that can be employed. This is just one example, PICO. And PICO is an acronym used to help formulate a well-defined, researchable question. P, patient, population or problem. I, intervention or exposure. C, comparison. O, what are the outcomes? Explain further. Patient or problem? This describes a group of patients similar to your own possibly. What's the intervention that you're considering? What are the main alternatives to the intervention? What do you hope to accomplish with this intervention? So for example, in elderly patients with congestive heart failure, they're on a diuretic. Does the treatment with spironolactone, furosemide, does it work? Then you compare it with standard therapy alone, which could mean fluid restriction. Then it leads to a decrease in hospitalisation, or it doesn't have any effect as an outcome. Other examples could be kids with otitis media, the intervention being antibiotics. C, no treatment, comparison here, except for paracetamol. And what's the outcome? You've got lots and lots of examples to address your research question. PICO is just one tool. So, how do you start evidence-based practice for nurses? Or for any researcher? You define the patient's problem. Identify information required to solve that problem. Perform a literature search. And critically analyse it. Obtain a clinical answer for the patient's problem. Develop clinical guidelines or a protocol. Evaluate those guidelines or protocols. And establish practice guidelines. Then communicate that information. Disseminate it. Let people try it and see whether it works. As I said, there are 6 steps essentially. Ask a clinical guiding question, search for the best evidence, critically appraise that evidence, integrate the evidence with yours clinical expertise, evaluate the outcomes of the evidence-based practice, and disseminate that outcome. Think again. Is using evidence-based practice important for nurses and nursing? Well, evidence-based practice in nursing facilitates nursing care. It defines what best practices are. It enhances nursing efficacy or efficiency. It ensures that nursing care advances. It can employ new knowledge, which incorporated into developments and practices, and therefore improves patient outcomes and satisfaction. How can evidence be merged into education and practice in nursing? Well, in the educational setting, it provides an environment in which students can learn about research processes. Students can be given the opportunity to explore different theories and evaluate them in light of the research findings, and research projects can be incorporated as a criteria for graduation, which it is in many colleges and universities. Participants can learn about research methods because it provides an understanding of the research process, and it encourages participation in research activities and enables students to become intelligent and proactive as research consumers. Nurses as consumers are knowledgeable, or should be as knowledgeable consumers, because they have knowledge about the research process. There's an aptitude to evaluate information logically. Skills are developed to apply that knowledge gained, and they are then able to conduct research. In contemporary nursing, research in developed countries, academic nurses and senior clinical nurses are primary researchers, and they utilise research into clinical evidence-based practice. Nurses do the interpreting, evaluating, and determine the credibility of the research findings for evidence-based practice. All nurses are expected to be proactive consumers of research within their specific domain of their specific clinical practice. And nurses as researchers have to be able to determine whether that research is noteworthy and whether it requires further investigation before it can be applied into clinical practice. The findings have to be considered for the utilisation and application into evidence-based practice. So, reflect again. Are there any barriers for regarding evidence-based practice? Well, there could be a shortage of critical mass and research capacity in nursing, a talent gap. There's no organisational support for evidence-based nursing. There could be a lack of commitment to improving and changing practice. There could be a culture of inquiry which relates to evidence-based practice culture which is lacking in a specific healthcare environment. And this absence of active managerial leadership which can have an effect. Some people refer to it as the Plato gap. They are those who know but do not act, and they are those who act but they do not know. Which basically means if you know about evidence-based practice, you don't do anything about it. Or if you don't know about evidence-based practice, you do what you want to do. There's a gap, which could be considered to be a theory-practice gap. What about other barriers? Oh, it's not of any value. Look, we've always done it this way, so we're not changing now. Nurses don't understand it, lack of knowledge. Oh look, our workloads are just too demanding, no time. Oh look, we don't actually see the research reports, they're not accessible, and when they do come, we have trouble understanding what the statistics are all about. So what strategies could be employed to support evidence-based practice in nursing? Well, strategies could be leaders. Nursing leaders need to support and encourage a culture of evidence-based practice. Medical librarians need to teach researchers and healthcare providers how to search for data, the literature. Healthcare providers and researchers need the time to critically appraise studies and implement these findings. Look, there could be journal clubs, practice clubs. Researchers need to be taught how to write clear reports that can be translated into practice, and evidence-based practice needs mentors that are readily available and accessible to the novices or the evolving researchers. Evidence-based practice and knowledge, it has to be skilled. There has to be a culture that supports evidence-based practice and provides tools to sustain that. There has to be a belief in the value, and there must be evidence-based practice mentors. So in conclusion, evidence-based practice in nursing guarantees care. Interventions are based on data from research which ensures that clinical practices are appropriate, safe, and of the highest quality. Nurses must therefore develop a culture of inquiry to support and maintain this process, which we call evidence-based practice. So, demand evidence and think critically. Thanks everybody again. If you enjoyed this Dr. Manny Learnshop, look at some of the other ones that are available to you. See you next time.